Welcome back. Now, the Ministry of Health and Social Services, with support from Global Fund and PEPFAR through USAID, has been implementing the Voluntary Medical Male Circumcision program countrywide with the aim of circumcising 80% of men and boys aged 15 and above by the year 2025. Namibia is about to celebrate a milestone of 270,000 smart cuts next week. With more on this, I'm now joined in studio, that is by Mr. Kauuma Vejorerako, who is the Deputy Chief of Party Technical Director, Abt Associates, as well as Mekondjo Aupokolo, who is a Voluntary Male Medical Circumcision National Coordinator. Gentlemen, good morning and welcome to GMN this morning.
Good morning.
Okay. Now, let's start with you, Mr. Mekondjo. Based on the overwhelming evidence that we have received from the Ministry of Health and Social Services on the male circumcision program that was launched in 2010 as part of a combination of prevention of strategy. Talk to us about this voluntary male medical circumcision. What brought about it? Was it necessity to do so?
Okay, thank you for the question. Good morning, everyone. Like the rest of the world, Namibia is a signatory to the political declarations that aimed at ending HIV/AIDS as a public health by 2030. And to achieve this goal, the country needed to develop strategies or interventions that have been proven to produce effective results. And one of the recommendations that was given by among many recommendations that was given, is to consider VMMC, for the member countries to consider VMMC, especially countries with high HIV prevalence and low circumcision prevalence. These are recommendations that came from WHO and UNAID. And as a country, we sat down and we look at what we have at hand, and we decide it's important that this be incorporated in our combination prevention strategy. Among others, in addition, remember, we only had condoms and HIV testing, PrEP. We decided let's add this intervention. As a result, it was rolled out throughout the country. Today, it's been incorporated in the normal health delivery, and it's available in all 14 regions.
Okay. Now, Mr. Kauuma, for the benefit of our viewers, let's talk about the importance of this VMMC. What are the benefits?
Yes, thank you. Talking about benefit is that circumcision have been proven to reduce HIV infection among men by 60%. If you put it on a scale, 60% is 40 is quite a big chance of you not getting infected. It improves hygiene, reduces STI among men, and it also have other benefits such as reducing penis cancer among men, because penis cancer is linked to cancer among men, linked to HPV virus, which actually trigger the development of cancer among men. So there's also other benefits to women because, of course, if their partners are prevented from getting infection, the infection among themselves are also reduced. It also reduces cervical cancer among women as well, because like I said earlier, it is linked to HPV virus, which actually prone among women if the men are infected.
Okay. Now, you said get the smart card. It's easy, safe, and simple. How has the Namibian public been able to respond to this campaign? Have they done so, or are they still uncertain? Or what was the response?
The response has been very good, quite overwhelming. Remember, getting a smart card, probably just a technical term, but circumcision is not a new phenomenon in Namibia. Be it biblical or cultural, it has been being practiced in Namibia for generations, a lot of generations, and still being practiced. What happened is like this. In the past, remember, we didn't have a lot of interventions that have targeted men specifically in comparison to our counterparts, females. What the ministry did, they came up with a comprehensive package that as an entry point to care for men is not only VMMC that have been offered, they develop an attractive package for men whereby It's a platform whereby men, you talk about social issues, violence, screening of any other issues that needed to be. As a result, it was well accepted to men. And key to this success was the community ownership. It had been very key. And that's how we became successful. I think at the beginning of the program, when it was implemented, countrywide, our prevalence was about 19 to 20%. But currently, we stand almost at 70%. It had been a quite positive response from men.
Okay. Now, building on to that indication, talking about the positive response that we Namibians have responded to in terms of this campaign, we know that Namibia currently enjoys now a medical male circumcision rate of 64%, amounting to approximately 270,000 Namibians. Would you rate this as the same way as he did, it being an achievement?
This is quite a big achievement in terms of, the men that are targeted initially. So I think for the target age groups, the program targeted to circumcise over 330 men for us to achieve, to actually have an impactful intervention. So that, remember we are saying we are trying to reduce HIV infection among men, so it is viewed as if we could have reached that target, would have had a very positive achievement in terms of reducing HIV infection among the population. So 270 circumcision is quite a big number, and it is worth celebrating.
Okay. Would you say that if your target is 330,000 by the year 2025, do you think that you're still on course to attain this target?
We are quite on course, and I think with the current performance, I think we might be able to achieve that by that time.
Okay. I just wanted to add on that one. Remember 3 years back, we just celebrated 150,000. That was 2019. And this year we are already, so given the performance in the last 3 years, I think we're still on course.
Almost double the amount in 3 years. So on average, you're talking about how many circumcisions in a year?
From 20,000 to 30,000 per year.
Okay. Okay. Now, earlier you mentioned on the issue of some of the myths in society currently that might affect this voluntary medical male circumcision, or preventing men from actually participating. Talk to us about some of those challenges and what they actually pose towards the country's efforts in, combating and reducing the infections of HIV/AIDS in the country.
Okay, I think I will answer that question in 2 ways. Okay, I will talk about myths. Of course, there have been existing myths in the country. One of them was, we have been battling with it, is that seasonality, that circumcision can only be done in winter. I think with the current community education programs, I think it have been, that have been reduced or addressed. However, there are also other barriers that we pick up as we are reaching men. The issue of pain, of course, circumcision is viewed as a very painful procedure, of which, what I can say on that is that the only pain that one feels during this procedure is when you are getting the injection, which is a very minimal pain, and during the procedure, one should not be feeling pain at all until you are done. And the issue of, that circumcision is only for some cultures. I think as an intervention for HIV prevention, this targets all Namibians, men. It doesn't have to be among certain cultures, not other cultures. And I think, from older age, most of Namibian tribes have been practicing circumcision. This issue of, reduced sexual pressure, shortened, penis, I think since circumcision only removes the foreskin, it doesn't affect the length of your penis, as well as there's no, there's no evidence to say it reduces sexual pressure. In fact, studies have shown, that was conducted in other countries, have shown that men indicated that it does not affect how one enjoys sex.
quite interesting topic for those men that might be watching. So let's talk about the fact that, you know, although you are saying your target is between the ages of 15 and above, and you're saying it's voluntary, how does voluntary apply to someone that's 15 that yet can't make a decision, especially when it comes to circumcision?
It's still voluntary. Somebody from 15 to 18, they're still under the care of their parents. However, the main decision have to come from the client themselves, and then they should be consented by the parent. So there is no way that these individuals have to go, the young boys have to go themselves to the facility. And evidently we have seen that, actually the demand among the young boys have been extremely higher than the elder ones.
Okay, could this be also perhaps maybe linked to a sexual pattern of activities in this country, because children as young as 13 are getting pregnant?
Yeah, we might not have proof of that, but from the ministry side, I think there are a lot of factors that are involved in that. As we said, this has been a practice that has been practiced throughout the country. The younger boys are quite easy, they easily digest the messages, and also from the peer pressure, actually.
Okay. Now let's talk about some of the interventions that you have actually done from your side to counter these taboos and these myths that are growing in society. What sort of campaigns have you had to counter this?
We have mass media communication package that we have developed. If you look at our newspapers, are usually flooded with VMMC messages. We have hotlines. We have also individuals role models, like community role models. Remember, in the past few years, we had influential people like King D, who became the VMMC ambassador. So it's quite well accepted, actually. Yeah.
Okay. And additionally, actually, the program have also set up other mechanisms to counter these taboos and myths. You know, we try to develop our messages based on what is on the ground. Okay. So we use what we call human-centered approach. So there are issues that are on the ground, and then you work with whatever is available to develop messages that to address directly the issues that are on the ground.
Now, we did mention in the beginning that this activity is taking place as a result of the Global Fund and PEPFAR, but talk to us about other stakeholders that are actually involved in this initiative.
Yeah, the ministry have benefited from this strong relationship with our international partner. To start with the WHO and UNAID, they've been with the ministry for quite some time, and through PEPFAR, we have had the good relationship, or the support have been coming through Center of Disease Control, that's CDC, and USAID. At the beginning of the program, we had ITEC and Japaigo that have laid the foundation. They were funded through PEPFAR. They were complementing what the ministry has done. And currently, the ministry is getting the support through USAID, PEPFAR, USAID, through Abt Associates, to assist with the implementation and also with technical assistance, in addition to the Global Fund. So those are the technical support that we have. But we have also silent partners that we have, the community itself. We have the line ministry that have been participating in this sector, especially the key ministry, the Ministry of Education, the Correctional Services, and the Correctional Services and other ministry, actually. They've been the key partner, stakeholder to this exercise.
Okay. Now, so far we have concentrated on the fact that this is a Ministry of Health and Social Services initiative with its different partners and obviously being a public institution. What about the private facilities? How have they been coming in terms of support when it comes to this initiative?
The ministry have engaged the private facilities. We have a public-private partnership with selected ones. And the ministry have to cater for everyone, and sometimes the resources are not there. We privileged to have received support from PEPFAR again, whereby a man working in some of the private sector get the smart card and they go back home for free. We have facilities in Commerce region, we have facilities in Hardap region, we have facilities in Erongo region, and also Oshana region.
Okay. Now, we also earlier speak about the fact that you'll be celebrating a milestone that sometime next week of 270,000 smart cards on the 9th of March, to be specific, in the Orongo region. Talk to us about what this celebration actually entails.
Yes, I think the event is planned to take place in the Orongo region, particularly Swakopmund, at Modesa Stadium. And I think the aim of this activity is just to celebrate the achievement that the country have done so far. And since Orongo is one of our new region to scale up circumcision services, we thought let's take it to them, and I think the region welcomed it with both hands, and they are leading this event. Like you said, it's taking place on the 9th of March. And it will start with a march from DRC settlement all the way to Modesa Stadium. And I think what one can say now is to maybe just to call upon all the districts in Orongo to partake in this event, since we are celebrating this type of achievement.
Okay. Now, before we wrap up our conversation this morning, gentlemen, I think perhaps maybe as a final question to you, what message do you have specifically to the Namibians that might have been watching this conversation that we're having this morning about this voluntary male medical circumcision? Let me start with you, sir.
Yeah. The only message that I have is for the fellow Namibians to meet the government halfway, especially when we come to the fight against HIV. We are calling all other men to participate in all the endeavors that the ministry have put on the VMMC, knowing your status and participating on the PrEP and other intervention. We are really calling, and for the men, the fellow men that are in Orongo, we are calling them in numbers to come and join this march. For the Orongo, just in addition to what my colleague has said, it's not only the commemoration that we're going to have. Actually, this is done, the office of the Honorable Governor is taking a lead in this, and it has been turned into a male health week. It's a male week that we are having. So we are calling all other men, be it from workplace, just everyone just to join the march.
Yes, I think I will just build on what he said, to call out fellow men, especially as a program, we are seeing a bit of, not hesitance, but hesitance among older men. As we know, we are also viewed, or maybe most at risky population in terms of, exposure to HIV. So I will urge men countrywide to actually just seek services. Services are available in all the 14 regions, and I think it's for free, and it's up to us to just get up and access these services for free, and also maybe to women as mothers, to make sure that their children, boys, are being access these services for free, so that we can have HIV-free nation in future.
We have also hotlines that are available for all the regions that are accessible any time of the day.
Okay, maybe you can just share with those hotlines with us, that for those viewers that might want to make use of them.
Yeah, we're definitely going to share them with your office, because each region has its own hotline.
Okay.
Yes.
Yeah. Thank you very much, gentlemen, for making time to be here with us this morning, and we hope that the event next week on the 9th will definitely be a success.
Thank you.
Okay. Now that was Mr. Kauuma Vejorerako, who is a Deputy Chief of Party and Technical Advisor, Abt Associates, as well as Mr. Mekondjo Aupokolo, that Voluntary Medical Male Circumcision National Coordinator, talking to us about the issue of Voluntary Medical Male Circumcision Program that aims to attain 330 smart cards by the year 2025 in the country. Not forgetting that next week they will be commemorating the 270,000 smart card that has been attained in Namibia. So if you are in the Orongo region, specifically the men, please make sure that you make all your way to the Modesa Stadium on the 9th of March and participate in those activities, and also being informed that next week it will be the health week in the Orongo region. So do the right thing, turn up and do your part